Hi, my name is Blanca and I will be demonstrating on how to do a 2-view chest projection x-ray. So first of all, before even getting our patient, we want to make sure that we have our room set up and ready to go. So my console, I already have it set up to the wall bucky, and for our first projection, which is a PA chest projection, my technique will be 110 kVp and I would say between 8 and a 12.5 mass. As for my second projection, which is left lateral chest projection, for that my technique will be 110 at kVp and I would say between 20 to 25 mass. So next I will be detenting my x-ray tube to my wall bucky, and that will be at 72 inches. So I'm going to detent my x-ray tube to the wall bucky. Again, it's 72 inches. Then I'm going to angle my x-ray tube at a 90-degree angle. Next, here I have already my IR. So since we're doing a female patient, we're going to do a portrait orientation and always making sure that we have a little green stripe at the top. Now, if you were to do a male, then it will be a landscape orientation and then making sure that your green stripe is towards the patient's right side. But in this case, we're sticking to portrait. Once I have that in there, just making sure that my collimation line is to the size of the IR, which is a 14 by 17, and placing my marker, that way I won't forget. So once that is done, I'm going to go ahead and get my patient. Come on in. Hi, my name is Blanca. I'm a radiography student and I will be doing the exam for you today. And can I have your full name?
Denise Cardinal.
And your date of birth?
8/9/92.
Okay, and what brings you here today?
Chest pain?
Chest pain. And for how long has that been going on?
5 days.
5 days. Have you had any previous surgeries?
No.
No? And is there any chance you might be pregnant?
No.
Okay, awesome. So next I'm going to ask for you to go ahead and change into a gown. Please go ahead and remove anything from the waist up, your bra, also any jewelry pieces or necklaces that you might have on you. Okay? And I'll wait for you up here. Okay. So while we wait for our patient, and since our first projection is a PA chest projection, it's going to be mid-sagittal plane at the level of T7. So come on, you could go ahead and follow me. So you could go ahead and stand here towards facing the wall. And if you could go ahead and put your arms around the cord and get in closer as much as you can. Okay. Then I'm going to make sure to align my x-ray tube to my patient's body structure. And also always making sure that you have 1.5 to 2 inches of collimation line above the patient's shoulder. Now I'm going to align my wall bucky to my x-ray tube. I'm sorry, I'm going to go ahead and put this down. So once I have that ready, I'm going to go ahead and put my marker a little bit to the top, that way it's not in the anatomy. And I'm going to ask for my patient to roll their shoulders forward. That way we can remove the scapula out of the lung field. So once we have that ready to go, then shield my patient, and again it's mid-sagittal plane at the level of T7. So Ms. Carvajal, if you could go ahead and just follow my breathing instructions. So breathe in, breathe out, breathe in, hold, x-ray, beep. You could breathe now. You can relax your shoulders. And I'm going to go ahead and remove my IR and place it on the side as I get my other IR. So as how I mentioned, my second projection is the left lateral chest projection, and it will be portrait orientation, remembering that the green stripe is at the top. Next, I'm going to have my patient looking towards the wall, so her left shoulder will be towards the wall button. You can go ahead and stand straight. Also, if you can go ahead and put your arms above your head. So now I'm going to position my X-ray tube to her body structure. You can go ahead and take a little step forward. And next, I'm going to align my wall bucky to my X-ray tube. Go ahead and put your arms up. Going a little backwards, taking a little step. And here it will be mid-coronal plane at the level of T7. That will be our central ray. So Ms. Carvajal, if you could go ahead and listen to my breathing instructions. So go ahead and breathe in, breathe out, breathe in, hold, X-ray, beep. You could breathe now. You can put your arms down below. Then I will go ahead and remove my IR, and you're ready to be taken into the reader. And that is how you do a 2-view chest X-ray projection.
So now I will be going over the structures and evaluation criteria for our PA chest projection. So starting off with the structures, we want to make sure that we are able to see the aortic knob, also our heart, as well as our diaphragm, our lungs, which here we have our left lung, our right lung, and the air-filled trachea. Now, as for the evaluation criteria, we want to make sure that there is proper collimation in our image. Also, that we can see the entire lung field from the apices to the claustrophrenic angles. And another thing will be making sure that the sharp outlines of the heart and of the diaphragm are visible. As well, checking for no rotation, and that can be done by checking that the SC joints are equidistant from the spine. Also, that the scapula has been removed from the lung field. So here we have our left scapula, our right scapula, and we could tell that it has been removed out of the lung field. As well as making sure that there is 10 posterior ribs above the diaphragm. So here we could see them and they're pretty visible. And finally, just making sure that you could see the spine through the heart shadow, which we could see here. For the evaluation criteria for the left lateral chest projection, we first want to make sure that we have proper collimation in our image. Also, making sure that the arm or its soft tissues are not overlapping the superior lung field. So as you can see here, due to the fact that we asked our patient to put their arms above their head, this allowed for us not to be able to see no arm or its soft tissues, and for them not to be visible in our image. Also, another thing we'll be checking that our hilum region is at the center of our image, and that we are able to see the sharp outlines of the heart as well as our diaphragm, as we could see down here below. And our claustrophrenic angles, making sure that we have that in our image, which is very important. But also, one of the most important things is making sure that our posterior ribs are superimposed. As we can see here, they are very superimposed. And another thing is checking that there's no rotation, and that is by checking the sternum, that there's no rotation in our image. And finally, just making sure that the open thoracic interval spaces, as we can see here. And that will conclude our evaluation criteria for our left lateral chest projection.